now, thanks, Pat, for helping to get us all oriented and get to know each other a little bit better. With that in mind, I'll introduce myself and just a few of the other people as well on this call. So my name is Craig Cohen. I'm a professor of OBGYN at UCSF and also co-director of the University of California Global Health Institute, which covers our 10 campuses with partnerships within California and around the world. And GloCal is one of our leading programs. I also am one of the PIs for the GloCal Health Fellowship since its inception as well. We'll have Pat introduce herself briefly, and then our other people who are part of GloCal. So Kimberly Bale, the Deputy Director, and also Linda can briefly introduce herself, and then we'll get started.
Hello, everyone. Thanks for joining us. I'm Pat Conrad. I'm a distinguished professor of parasitology in the School of Veterinary Medicine at the University of California, Davis, and the Associate Dean for Global Programs there. And along with Craig, I also co-direct the 10 campuses of the University of California Global Health Institute. Again, a great opportunity to work with Kimberly and Linda. It's a wonderful team.
Hi, everyone. I'm Kimberly Bale. I've been in contact with a lot of you already. I'm the Deputy Director of GloCal Health Fellowship, and I'm located at UCSF, although, of course, I've been working at home for the last 6 months in the San Francisco Bay Area.
Hi, everyone. I'm Linda Shin. I'm the Program Coordinator at the UC Global Health Institute, and I work closely with Kimberly for this program.
Thank you. I'm now going to move to, I'm going to be giving, the way we're going to run today is a brief presentation about the GloCal Health Fellowship. I know all of you are interested in applying, which is fantastic, for this next cycle with applications due in early November. And then we will have some brief discussion by some of our wonderful alumni that have also joined the call, so thank you for joining. And then we'll open it up to questions and answers, hopefully answers will move us to the conclusion. So University of California Global Health Institute GloCal Health Fellowship Program is really a unique program. It's one of 6 funded consortia by the Fogarty International Center to support year-long intensive global health experiences for both people coming from the US, postdoctoral fellows, and then advanced doctoral and professional students across our entire system, 10 campuses. And then also in partnership with our 17, we have 20 affiliated sites in low and middle income countries in 17 of those countries. So the program was first funded in 2012. It's, as I mentioned earlier, one of 6 funded consortia. There's another one within the University of California system called Global Health Equities Scholars, or GHES, led by Lee Riley at UC Berkeley. We, so far to date, have had 127 fellows across the program that have been funded in the first 9 cohorts. This shows you the program leadership, myself at UCSF, Stephanie Strathdy at UC San Diego, Pat Conrad, who's joined us from Davis, and Jeff Klausner, who is at UCLA. We have 4 primary components to the program. So again, it's a year-long experience. Usually for most people, it starts July, although this year we've had to make some allowances for especially the US fellows traveling due to the COVID-19 pandemic. So the primary focus is on developing and designing a research project, a mentored research project over a 12-month period. It's meant to be hands-on, experiential. For those who are coming from the US, it's meant to be an opportunity to develop your research, but importantly, to understand the local issues, to create strong collaborations and networking, make friendships, all sorts of things during this year-long experience. And it's a requirement of the program. In most years, this year we're being a little more flexible to spend 11 of those 12 months abroad at the site in country. Mentorship is really the strong element of this program. Individuals or applicants, as you know, if you've looked at the application, are required to identify three mentors, including a mentor. If you come from an LMIC, so a primary mentor would come from your institution, and then one or two mentors from the University of California, again, from any of the campuses. And Kimberly and I, and I'm sure the other PIs, help applicants to identify mentors or potential mentors, especially those coming from outside the system. And then we also ask for identification for what we've called historically a trans mentor, or someone who can support you either in a transdisciplinary element of your research or a professional mentor. Global health education is another element of our program, and we provide many options. We provide some resources, funding, so that one can sign up for, now it's virtual, predominantly than virtual learning, although there are, when we are able to meet again face-to-face, there are opportunities to use these funds for some in-person workshops, short-term workshops. But this is not the major focus of the program, but provides some opportunities from additional training that may fit your research needs. And career development is a very essential element. The fellowship is really a transitory place. You don't want to be a fellow forever. So we provide opportunities to meet with leaders in global health from the University of California system, as well as our partners in low and middle income countries, to start to think about what sort of a professional path you want to be carving out for yourselves, providing a lot of opportunities for close discourse with those individuals. So this is where we work. This is the map, and I'll show you the list in just a moment. As you can see, we're heavily weighted to Africa, our program, and these are the lists of the various programs. We do have actually we have 4 partners in India, but 3 countries, so 3 countries, India, Bangladesh, and Vietnam. And in Latin America, we work in both Guatemala and in Peru. So these are, I imagine at this point, if you're applying, you've already reached out. Either you're coming from one of these countries or you're reaching out to the institutions in these various countries to create the connections that are needed and develop and identify a mentor that would be interested in supporting you and your application. I should also mention in regards to countries, sometimes people come, I know Kenya well because I've been working there since 1994. So for example, our primary partner in Kenya is the Kenya Medical Research Institute. And however, we've also been supporting fellows who come from the University of Nairobi as an example. And that works as long as they also identify a co-mentor at KEMRI, which for the most part has not been a problem. So it allows people to work across the country and across various institutions, and yet they still need to have that central linkage with our partner. So this is who GloCal is open to. So it's open to US postdoctoral fellows, foreign postdoctoral fellows, again, from one of the 17 countries. So you can't come from Canada and be in our program unless you come, and unless you have citizenship in one of our 17 countries or also have our US resident. And then senior professional students from the US or from the UC system across any of our 10 campuses, include MD, DDS, DVM, PharmD, et cetera. And then advanced doctoral students. So these would be usually our doctoral students who've used the GloCal Fellowship as a funding mechanism, as an opportunity to collect the data they need for their doctoral dissertation. And again, they must be connected with one of the 10 UC campuses. So although the GloCal historically has been rooted in UCSF, San Diego, UCLA, and Davis, we are encouraging applications from both postdocs and doctoral and professional students from any of the campuses. And this year, for example, we have a fellow from UC Santa Cruz, and last year we had a fellow from UC Santa Barbara. So we pride ourselves at GloCal being very interdisciplinary. Of course, many of our fellows come from public health and health science backgrounds, including veterinary medicine, pharmacy, dentistry, and medicine. But we also encourage people who come from non-health disciplines, human genetics, the social and behavioral sciences, engineering, mathematics, anthropology, and agriculture, environmental sciences, just to name a few. I mean, we'd be open to people who come from a legal background, who have a law degree. essentially anything, as long as there's a human health element to it, to your proposed project, you fit within our program. And in fact, the photo here is of one of our alumni in our first cohort, who was at the Scripps Institute in UC San Diego working in pharmacology, combing the oceans for cyanobacteria, so oceanography connection, to identify novel therapeutics for treating people with cancer off of the coast of Panama. So the selection process, we have a scientific steering committee, which is actually on our website. We have a little bit of turnover this year, so it's not quite up to date yet, I believe. But these members, there's usually over 30 individuals then do the initial review of your written applications. And this includes your personal statement, your CV, as well as a several-page document, your research concept of what you're proposing to do, and your letters of support and recommendation. We then rank those candidates based on the scores that they provide. Each application is reviewed by 3 individuals. And then we usually invite about half of the people that have applied for interview. So in a typical year, and this is anything but a typical year because of COVID, we usually get around 40 applications. We then usually interview approximately 20 or the low 20s. And the interviews are panel interviews with usually the people that reviewed your application initially, as well as one of the executive committee members. And then based on that scoring, we then rank the applications, and then we send out acceptances, wait list, and not acceptances. The decision eventually is made by the leadership group based on mainly the score and ranking, but also we're looking at diversity of disciplines, campuses. We also get some funding that's aligned with HIV, that we have to fill those slots, and we have non-HIV money, we have mental health money. So sometimes we don't go straight down the list. Definitely the top applicants all get funded. But then the next, somewhere down the list, we have to look at priorities, funding priorities, and other sorts of factors as well. We have had a good, very good fortune in the last few years of getting additional money after we make the first acceptances, and been able to increase the number of trainees that we've had in our program over the last few years. So as I mentioned, this is some of the research priorities. HIV, we just actually today, I guess I can announce it to you, the Fogarty International Center just gave us $290,000 new to take people with non-HIV related topics. So that was fantastic. So that's, you know, 290, that could be another 5 fellows. So Kimberly's smiling. So anyway, it's a good year to apply because we just got more money, and that happens. These are on this list of centers and institutes. Can somebody put themselves on mute, please? Thank you. These are the other NIH institutes in addition to Fogarty that provide funding. I know many of these might not too many of these will mean anything to any of you, but the NCI is National Cancer Institute, National Eye Institute. If you have any questions, if your topic area is of high priority, you can always reach out to Kimberly, and we can take a first look at that. So we've had a lot of luck getting funded by multiple institutes and centers across the NIH of late, and that's because we've had such excellent applications. So these applications get screened by us, ranked, and then they get sent to the various institutes at NIH, and then based on their own criteria, they'll, in many instances, they very likely will fund. So put in your best application, work with us on some of the targeting could also be helpful as well. So I'm just going to give you some examples of some of our alumni, and then again, we're going to be hearing from some of our alumni. So Wan Dong was a medical student at UCLA, part of the UCLA program, and studied antibiotic resistance and non-pathogenic bacterial flora in Vietnam. He's currently a pediatric resident at UCLA. Kendra Beard, a doctoral student at UC Davis, looking at understanding associations between infection, inflammation, iron status in infants. worked in Kenya, and she's now a nutrition scientist with World Fish in Malaysia. Lauren Hack, she was a US postdoc connected with UCSF, looking at school home programs for youth with attention behavioral concerns in Mexico. Unfortunately, Mexico is no longer one of our target countries because they're now G20. She's now an associate clinical professor in the Department of Psychiatry at UCSF. Hendry Sawe, international postdoc with Muhimbili University of Health and Allied Sciences in Tanzania, studied emergency care of acute episodes of illness with major chronic diseases in Tanzania. He's an associate professor and head of emergency medicine department at MUHAS. He's also the site PI for GloCal with MUHAS, and MUHAS has become one of our leading partners. So we're very excited that Hendry was in the program in the first place and continues to lead and now mentor fellow GloCal fellows as well as other trainees. Larissa Otero was an international postdoc with University Peruviana Cayetano Heredia. I know I didn't say that right. I saw Kusi on there, so she's going to say it correctly when she talks. She was studying preventing TB in children. She's an assistant professor at UPCH. And she also is the first recipient of a K43. These are highly coveted awards from the National Institutes of Health these are career mentored scientist awards that just a few years ago became available to scientists from outside of the US. And she is the first recipient from Latin America. So we're very proud of her, and we have her speak often, and she's wonderful. And she's also now on our trainee, she's now a member of our traineeship advisory committee as well. So mentorship is really a foundation for the success of GloCal. Of course, you bring in your amazing ideas and your training and your connections and so forth. But it's really through support of what we like to think of it as a team approach for mentoring, to identify mentors that can support you professionally and scientifically to advance your career. So we have requirements for mentors. I mentioned those earlier. To have a mentor from one of the 4 GloCal Consortia campuses. You can have another mentor from any other UC campus. You need to have at least one mentor from the host international site, or if you're from that country, from your home institution. And then we have this idea of the trans mentor, which I've mentioned already. We have expectations that these mentors are not just mentors on paper, that they're actually actively meeting with you. And during COVID times, it may not be face-to-face, but then they're meeting with you virtually. I meet with my GloCal mentees usually weekly or bi-weekly at the least, online, just to go over their progress, questions they may have, any questions they have with next steps, professional development, and so forth. There's plenty to talk about. Sometimes for those who are very engaged with the research, we get into the weeds of questionnaire design or sample selection or writing the next grants. Just a whole variety of topics to keep your mentors busy. We realize it's quite a commitment for the mentors, of course, for the mentee, but quite a commitment for the mentors. But we actually have the mentors sign a mentorship compact to agree to our expectations. We also have the mentee sign that as well. Tips for a successful application. So we have examples on our website that you can look at for successful applications. I highly suggest that you look at that. And you'll get an idea of what previously has been looked at, scored highly. And as you start to hone your craft of really writing your application, please work closely with your mentors. I think we can oftentimes tell when people have very cursory relationships with their mentors, and maybe the mentors have not had much input into your application. This is your chance to shine and put together your strongest application. We're also willing to work with you, not that I want to review an application before it gets submitted per se, but to answer any questions you might have. I know for some of you, like for our applicants who will be coming from low and middle income countries, you might have very little or no connection with your UC mentor, University of California mentor. We will try to connect you with people or help you identify people that would it would be good for you to work with. Sometimes if it's an area that we don't have expertise with people that we know readily, you'll still be able to work with people, but find somebody who just doesn't want to work with you on paper, but literally wants to work with you to help you advance your career. So we have collaboration. In fact, today we had the PI and program manager call. We meet every about 2 months or so, and we collaborate. Again, I mentioned the other Fogarty program within the UC system, led by Lee Riley at Berkeley. We collaborate on many different issues, including the orientation, which typically, or every year, but this past year, is actually at the NIH campus in Bethesda. I tell everybody it's my favorite work week of the year. I get to meet all of you that successfully apply. I get to meet the fellows from the other consortia that have similar research interests. I get to meet with the various leaders from the NIH. Tony Fauci comes every year to give this amazing motivational talk. Of course, this last year was all about working within the administration and around COVID-19. Previously, it was around HIV and Ebola, and he touches on all those topics. It's also, we provide some opportunities to develop some skills around nuts and bolts, how to manage your finances for research, something that I talk about, as well as security and all sorts of different issues. It's really an amazing experience. We have had regional mentorship development workshops, and we are planning to eventually go back to doing regional works in progress workshops, although they've been tabled again due to the pandemic. We've had publications together. We share resources, including now webinars on a whole host of topics. We're going to be focusing this coming up year, this current year, on several areas, including decolonizing and democratization of global health, which is a topic on probably all of our minds, both from the US perspective, but especially from our colleagues coming from low and middle income countries, how we can create stronger partnerships and collaborations in this new era and usher in a new era. We're also looking from the US perspective, how we can increase participation of fellows and scholars who come from historically underrepresented groups. And we are very sensitive, or we're becoming more sensitized and sensitive to some of these issues as they arise. And we really want to encourage those of you who identify as from one of those groups to apply. And again, if you have specific questions for us, please let us know now before your applications are due. We want to work with you. And then, of course, if you're accepted in the program, we also want to work with you and ensure your professional success. So this is a way to connect with us. Again, the applications are due November 2nd, which is kind of an auspicious day now that I think about it. It's kind of the day before the US election, for those of you who are following the US election, which is obviously a historic event.
Hopefully it's everyone who has a US citizenship and is planning on voting, please.
Yeah, but we can't advocate. Well, we can advocate for voting, not for who to vote.
No, we can advocate for voting. How you vote is up to you. We just need everybody's voices heard.
I agree. We want to, so vote. And then you can also contact Kimberly. I think you all obviously all have navigated the website, know how to find us, and so forth. All right, so I will end this part of the presentation. And I think now, Kimberly, I saw Kusi. Who else do we have as well?
We just have Kusi presenting. We have one alumnus on each webinar, yes.
Excellent. So Kusi, well, welcome. You're in Davis, aren't you?
No, I am in Peru now, in Lima.
Okay.
Yes, hello. Hello,
well,
everyone.
welcome. Yeah.
Thank you so much.
Yeah.
Okay, so I'll share my screen. Okay, there we go. So hello, everyone. Thank you very much for inviting me to be here. As has been said, my name is Kusi Ferradas, and I have been working on the project, the role of domestic animals and rodents in the ecoepidemiology of rickettsias in the Peruvian Amazon basin. So in this presentation, I would like to share with you a little bit about my project first, and then a little bit about my experience as a GloCal fellow. So just for those of you who don't know, rickettsias are a group of zoonotic bacteria that are transmitted between animals and from animals to humans by ectoparasites, including ticks, lice, fleas, and mites. So first, I would like to share with you why do I think it's important to conduct research on zoonotic diseases in the Peruvian Amazon basin. And I think it's mainly because people living in this area, especially the ones living in rural areas, are exposed to many risk factors for zoonotic diseases. First, poor living conditions that facilitate contact with very domestic rodents, as we can see in this picture. Lack of a sewage, I don't know if you can see, okay, there we go. Lack of a sewage system and a waste management system. Having multiple domestic animals living in the same house and in close contact, as we can see in this picture, a hen, a cat, and a dog living all in the same house. Keeping sylvatic animals as pets, and bushmeat consumption. And then why did I get interested in rickettsias? So some species of rickettsias can produce high mortality rates. And in Iquitos, which is the main city of the Peruvian Amazon basin, the seroprevalence of rickettsial diseases in humans and domestic animals is high. However, there is less data on rickettsial diseases in rural areas, where the seroprevalence has not been determined, and we don't know which animals are being the main reservoirs of these bacteria. So therefore, we designed this project to better understand the epidemiology and ecology of rickettsial diseases in the Peruvian Amazon basin. And for this, we established 3 specific aims. First, determine the seroprevalence of rickettsia species in humans, domestic animals, and rodents. Second, determine if rodents are reservoirs of rickettsia. And third, molecularly characterize the rickettsia species circulating in rodents and ectoparasites. So I'm doing this project on a rural community of Iquitos that is called Zungarococha. And this project has a field component and a laboratory component. And this was my first time conducting fieldwork. So in the field, I was in charge of hiring and supervising the field team, as well as doing some of the activities myself. So as you can see in this first picture here in the left, me and the field team surveyed the people who agreed to participate in the study in order to collect socio-demographic, environmental, and clinical data from them and their animals. Then we collected samples from dogs and cats. Third, as you can see in this picture in the middle, we collected blood samples from humans. And finally, as you can see in these 2 pictures on the right, we placed rodent traps inside the houses and around the houses to capture rodents. And then we did the necropsies of the rodents to collect tissues and blood samples. So then all these samples were transported to Lima, which is the capital of Peru and where the laboratory I work for is located. And we identified the ectoparasites and then did serologic techniques to detect antibodies against rickettsia in the serum samples of humans, rodents, dogs, and cats, and did molecular tests to detect DNA of rickettsia in rodents and ectoparasites. So until now, our results suggest that the seroprevalence of rickettsia among dogs and humans and the prevalence of these bacteria among pigs are slightly higher in rural areas than in urban areas of the Peruvian Amazon basin, which really motivates me to continue doing this research. And then, so all the rodents that we have captured until now are negative for rickettsia by PCR, but we still have a very small sample size and we had to stop the fieldwork due to the COVID pandemic. So other lessons that I have learned during this year is that first, fieldwork can be very challenging and can be full of surprises. And you need to respond very fast and without introducing biases to the study. So basically, you need to have a fast and a smart answer. But even though it can be challenging, it's the only way to really see and understand the health challenges communities face. A second thing that I learned is how to manage research funds. So before starting the GloCal project, I had worked during research, but I was in charge of laboratory experiments, and I never had to do a funding management plan. And I consider this is key for writing grants and for conducting research. So the GloCal Fellowship has been key for me to advance to my long-term goal, which is becoming an independent researcher on ectoparasite-borne diseases in Peru. And it has allowed me to do this in 3 main ways. First, it has been my first project as a PI, which means being involved in every phase of the project, not just in the science-related tasks, but also in all the organization, and as I said, in the management of research funds. Second, it has been my first project on ectoparasite-borne diseases. So I consider it as a starting point for continuing in this research line or doing research in this specific topic. And third, it has allowed me to strengthen my research network, not only by meeting senior investigators, but also by meeting many incredible young investigators, including other Fogarty fellows. The GloCal Fellowship has also been key to accomplish some important things this year. First, I have been admitted to a PhD in epidemiology at UC Davis to continue working on ectoparasite-borne diseases with Dr. Janet Foley, who is one of my GloCal mentors. So the GloCal program allowed me to meet her and also to start collecting samples and preliminary data that I will use on my PhD. So as I was saying in the previous slide, it has allowed me to start in this line of research or in this topic of research. Also, some other accomplishments. I have a poster accepted at the a poster and an oral presentation accepted at the 2020 American Society of Tropical Medicine and Hygiene annual meeting. Also, a couple of weeks ago, I was elected as a recipient of the 2020 ACME Future Leaders in Medical International Medical Entomology Award, which is also an award given by the American Society of Tropical Medicine and Hygiene. And also, as a result of having all my time protected for doing research, I was able to finish my first paper as a first author, which I submitted for publication a couple of weeks ago. And then, and finally, the last accomplishment that I think I have had during this last year, which is not a personal accomplishment, but a team accomplishment, is that we have motivated other Peruvian veterinarians to conduct research on ectoparasite-borne diseases. So Winnie Contreras, which is one of my lab mates at Universidad Peruana Cayetano Heredia, has been selected as one of the recipients of the 2020 RSTMH small grants to study the ecoepidemiology of Babesia microti infections in humans, wild rodents, and ticks in a rural community of the Peruvian coast. And I think that's it. Thank you so much.
Thank you very much, Kusi. Pat, you haven't had a chance to say very much except introduce yourself. Here's another veterinary scientist. I'd love for you to have a few words.
And we're very proud of her as well. So I met Kusi because she applied for the GloCal fellowship, and I think I may have helped with an introduction to Dr. Foley. That's what Craig and myself and the other faculty involved with GloCal, that's what we like to do. If you having the right mentor is so important. Sometimes things happen that you are struggling to identify the right mentor for the project that you want to do. And sometimes that's an area that we as faculty can help you with. It worked out well, I think, for Kusi. You see, obviously, if you're going on for a PhD, good job. Proud to have you. But that's the kind of thing to reach out to let us help you if we can. All right. But to make that all happen, if you think this is what you want to do, I would strongly recommend you get going quickly. All right. Because this is September, the applications are due in November. This is highly competitive. We have more money, but we also have a lot of interest. And so getting you connected with the right mentor, getting you going on your application, making sure you have all of the right information. And that's where Kimberly is fantastic on that, to be sure you're on track. Getting started is the key. All right. And that means getting started now. Okay. Is that, Craig, would you like me to add any more? I think that's the #1 recommendation.
No, it's terrific. It's true. And
Yep.
we've had quite a few veterinary
Proud of our fellows.
scientists in the program. Very proud of all of our veterinary scientists.
And well, yeah, and also, so veterinary, yes, but also as was pointed out at the beginning, GloCal, we are, I think maybe more than any of the other Consortia, really focused on disciplinary diversity. So we want people who may not see themselves as traditionally global health. We want the global health traditional people too, but we are looking for, if you're like an engineer, a social scientist, an economist, if you're from nursing or surgery, so we're not discriminating against all the human health people too. But we want a real diversity of people to apply.
So I think now we'll open it up to your questions. I don't know, how did you do this before, Kimberly? Do people raise their, because I can't see everyone, so we can't raise their hands.
Yeah,
People
and the chat has been put off too.
Oh, the chat's been off.
It should be working. Is it not working? I'm getting chat messages.
There's I can't use the chat, it says, but raise hand. There is a raise hand function if you go to participants. And down at the bottom, there's raise hand. And if you do that, like I can see that Gama Badawi has already raised hand.
Oh, I see that now. All right.
Okay, so maybe
try that.
Gama,
right.
Please.
Can I ask you?
Yes. Yeah. Can you hear me okay?
Yes.
Okay, great. Thank you for it. Really eye-opening and enlightening. I'm trying to find out about the mentors. So there are 3 mentors. So I'm from an LMIC, I'm from Malawi. So I'll have a local mentor, one from one of the UC campuses, and then the trans mentor, right? Mm-hmm. What I'm really trying to figure out is how aligned. I mean, it's very interesting. It's telling that there's this concept of a trans mentor who's not necessarily somebody in the field that you'll particularly be pursuing. But with the other 2 mentors, how closely aligned do they have to be with the particular area that I'm interested in going into? And obviously I say this because in my mind, the people who I've identified who I think would be incredible mentors, none of them are really exactly focused in my field. And I'm just wondering if that might come across as a weakness in my application, that I've got a bunch of mentors, none of whom may be able to contribute in a significant way in the exact area that I'm interested in.
Well, I'll speak to that, Gama. Thanks for your question. I think you need to make sure that you have the support you need scientifically to move your research forward. It's rare. It's a rare fellow that can identify one person. I mean, one person who can serve all purposes for mentorship in a scientific area. In fact, we really, as you mentioned, we've been mentioning a lot. We really encourage you to blend disciplines. So, in my area, for example, I'll mention one of our current fellows, a Kenyan OBGYN. So, like me, who's mentored by one of our GloCal alumni, who's also an OBGYN and anatomist, who is studying the changes in the retina in women who have preeclampsia. And he found as his trans mentor, an ophthalmologist at UCSF. So you can see there's a situation where an OBGYN is not going to have any idea about the eye, most likely, right? But by partnering with the ophthalmologist, the local UC mentor, and then myself, now this person has a full complement of mentorship. So that's one model that I would say would be the strongest for an application. The other role for a trans mentor, and it sounds like you have plenty of these, is to be a professional mentor. And those professional mentors, at least in my career, have been so important for my career development. But I don't really have a career develop unless I move my science forward. So I would say take care of the science first. If there's room to bring in a professional mentor who maybe doesn't work in your specific area, bring them in. You can have more than 3. I wouldn't do more than 4 individuals identified to be your mentor.
And I would say having a mentor that can advise you, as Craig said, on the proposal, on what you're putting forward is key. But we have before had people that are on the borderline, because remember, we're looking at you. I want to get that point in there, right? This is not all about the research project. This is not an NIH, research and R01 or something like that. This is about this is a fellowship. So we were really looking at you. You need to have a solid research project, but it doesn't have to be perfect. And Craig may correct me, but that's my opinion. But if there are problems, or maybe you're a little unrealistic, or there's questions about things, that's where if you have a mentor who has that expertise on there, I think it gives the reviewers greater confidence that some of those problems or some of those questions or things that you're not able to put in an application in that short period, you'll have good mentorship. But if you had mentors that none of whom had that expertise, that you are right, Gamma, that might raise questions amongst the reviewers. Would you agree, Craig?
I would agree, yeah. I see a question in the chat from Dr. Scola Matovu about is the start date in July negotiable? So, and maybe Kimberly could answer this question. We have this request often, and this year, in fact, because of COVID-19, many of the fellows have delayed the start of their fellowship. However, as a requirement, they needed to join the orientation in July. We already have the dates for the next orientation. So even if, we usually don't encourage people to delay, in this case, we did because of COVID-19, and we don't know what's going to happen, of course, for sure by next summer. But we do want most people starting in July. If you have a good reason why you need to delay by a few months, that's something that can be negotiated. Again, I wouldn't stress that in your application. Put together your strongest application. If you're selected, we'll work.
That is one of the real strengths of this program, because we bring the fellows together from all the different consortia. So that's what, like 100, some 150, and they get to meet with the directors of all the institutes. And you've been hearing about Tony Fauci. You've been hearing about that. Well, particularly Tony Fauci. You'll meet him, okay, and hear what he's done, and also the head of the NIH and of Fogarty and all. So right, Kusi, is that it was quite an experience. Yes.
Yeah.
We made a good show this year as a virtual orientation, and actually we got great reviews, so we're happy about that. What about some additional questions? I'm looking for hands over on this side. I don't see any hands. Who else has another question?
Don't be shy. This is a big chance.
I think Irene
Go ahead. Who's that?
It looks like Irene raised her hand.
Okay, Irene, go ahead.
Yes, how are you all?
Very good.
Greetings from Kampala, Uganda.
Yeah.
So thank you so much for this informative session. I've reached out to Kimberly. I think maybe I'll reach out again to give her feedback, but I think issues trying to find a mentor from the one of the UC campuses. Yeah, maybe I'll reach out more to Kimberly because I've been in touch with her. But maybe just, I don't know if other people from Africa or other countries are having maybe similar challenges. I've had to reach out to people, but not so much feedback. But I've been able to successfully maybe identify a mentor on site and my other mentor.
Yeah.
Yeah.
Do you, oftentimes we will send you to the site PI for the IDI. We'll have you work, because these individuals are usually connected to one or more of the UC campuses. Or for example, in Uganda, we work very closely with Moses Kamya and his group. Are you at Makerere, or where are you at?
I'm with the Infectious Disease Institute, so I'm working with Dr. Barbara.
Yeah, so why don't you reach out to Andrew?
Andrew Kambugu?
Yeah.
Oh, all right.
He's our primary connection, and he works closely with a lot of people at UCSF. I don't know your area of research, but he works with a lot of people at UCSF, and he can serve as your bridge, right? We also have other tools that Kimberly and I can share with you as well to help you identify people, but it's best if there's that personal contact. So if you can work with Andrew Kambugu, and if needed, we can get involved too, but start with your leadership at IDI.
Okay, thank you for that information. Kimberly had shared the avenues to locating the mentors. Yeah, but thank you. I'll reach out to Dr. Kambuga about that. My area is in pediatrics, so yeah, I will reach out in that.
Terrific.
Thanks.
Craig, you might have seen that Merlin Joseph has a question in the chat. Are only research topics focused on HIV mental health selected? Does research on non-communicable diseases also get selected? Do you want to speak to that?
The answer is completely yes, and in fact, we're able to offer more slots because
more than HIV, right? Not yes, just for HIV. It's two questions.
No, we're able to, yes, NCDs are a major focus of the program. Historically, we've been somewhat limited with resources, but just today we got $290,000, which again equates probably to like 5 positions. So please, and also we can maybe able to look for co-funding, whether it's through cancer or Heart, Lung, and Blood Institute, NHLBI, or if it's neural diseases, NINDS. We have lots of opportunities. So certainly NCDs, in this year, we're gonna be able to even offer more opportunities to fellows who want to focus in NCDs.
And look at Kusi's also there, that the rickettsia, but not an HIV focused project, right? Or zoonotic disease. So good. I see Hannah also. Hannah Chu has a hand up.
Yes. Hi. Thank you. So I was looking at some of the successful applications on the website, and it seems like a lot of the successful applicants have had experience in these developing countries. So does it hinder my chances of getting this fellowship if I haven't had like a very deep experience in these countries already?
So tell me, are you a postdoc, or are you a doctoral student? Who are you? So
yes, I'm a PhD student, and I'm not quite at the point where I can apply yet, but I'm just getting information early right now.
Yeah, so I would say, so again, I think for, obviously we're going to have much greater latitude. First of all, the answer is no, you do not need to have experience at this site that you plan to work in. Some applicants have had that opportunity, and that's terrific. But especially for somebody who's a professional student, like a medical student or advanced professional student like yourself, I mean, we wouldn't expect you to have experience at the site. So I would not worry about that. But that being said, you do need to have a way to connect with your local mentor, identify who's going to be your host mentor. And most likely that's going to be by working with your I don't know which campus you're coming from.
Riverside.
Yeah, so then you're going to be working with your UC Riverside mentor, faculty mentor, to identify who that will be, and then working on developing that project. Are you in anthropology? Or are you?
I'm in entomology, so insects.
Entomology, oh wonderful. Okay, yeah, so are you going to apply this year?
So I'm not advanced to candidacy yet, and I spoke to Dr. Neil,
Yes.
And he recommended that I attend this and maybe try to get a head start on things because I'm interested in applying.
You won't be ready for candidacy even by July next year?
Yeah, so I'm hoping to qualify around February of next year. So I hope, but we'll see how things go.
Then you should apply this year.
Yeah, you can apply.
Oh, okay.
Yeah.
You should apply this year because it won't start till July.
Oh, okay. Oh, I see. Okay, yes. I need to get my stuff together then.
You need to get your stuff together. Well, you need to identify where you're going to work. Maybe you already know that. And then you need to connect, again, identify your local mentor, work with your mentor at UC Riverside. And then you should identify a mentor at one of the 4 primary UC campuses as well. So if you need help with that, you can reach out to Kimberly or myself or Pat to help you do that.
Okay, thank you. I'll definitely be reaching out.
As they say, eligibility, I just want to mention the one thing to be clear. So if you are an MD, if you're an MD or DVM final student who will graduate, okay, by the time this fellowship would become effective, you would also be eligible because you would be a postdoc. Or if you already have an MD or a DVM, Doctor of Veterinary Medicine degree, then you can apply as a postdoc because those are doctoral degrees. So I think sometimes that's not clear and we want to make sure. And the other point from Hannah's question is that if after this informational discussion, you conclude, oh, I'm just not ready to do it this year, but I would strongly encourage you to consider working through the process, starting to get organized. Even if it's next year you're applying, I wouldn't, if you can apply, I wouldn't wait, okay? Because even if you're not successful, you will have gained a great deal of experience in applying, okay? Yeah, so that's, I guess, the biggest message, okay? Is don't wait for the perfect moment. Now, if you're eligible, could be the perfect moment. Would you say almost perfect?
Yeah, and we just got more money, so
yes,
always good to apply when a program has more money.
Yep, and if we've not learned anything else in the last year, it's that you cannot predict the future. Anything can happen, so go for it now. And we're
if anyone wants to submit a concept around COVID-19, that would be very much encouraged as well. So you might want to. Some of you, I'm sure, are thinking about that.
Yeah.
And we could use that new money we just got could be applied for non-communicable diseases as well as COVID. Another question. Do we have anybody else?
But the biggest thing Craig said while we're looking is that if you have questions, if you have uncertainties, reach out to us, okay? Or if it's not us, if you're at another campus, we'll help you make those connections, right, Craig? And Kimberly can direct you to the right person. We have a wonderful group.
I saw that Hannah raised her hand.
Sorry, yeah, I just had a follow-up. So if I do apply this year and potentially get it, and I don't successfully qualify next year, am I allowed to push off the fellowship for an additional year until I advance to candidacy, or is it?
We'll work with you.
Okay.
Don't have that be what limits you to apply.
Okay, thank you.
Yeah. Some of the others, if you just want to introduce yourself very briefly, where you're from, what you're interested in, that would be fine too, even if you don't have a question.
And before we do that, can we just give Kusi a minute because she made this nice presentation. Kusi, are there any advice that you like to give to this group? That hasn't been covered that you think is important about GloCal?
Well, yeah, I think the mentoring is really important, and then I would advise to spend as much time as you can in your field side, because something that happens to me is that because of the COVID pandemic, I cannot go to Iquitos every time I want. And I really miss that. And I think that's really this fellowship is a great opportunity to do that. So I think that's an advice that is important. And also I would say, that it's really important and really enriching to establish as many connections as you can with other Fogarty fellows, because the majority of them are awesome, all of them are awesome, but also it's a great opportunity to establish collaborations for the future too. So I think that's also
Very good.
important.
Anybody else want to talk? We just have a few more minutes before we close.
Sure, I'm happy to. Thank you first off, everyone so much for sharing all this extremely helpful information and insight. My name's Jeremy Tanner. I'm a behavioral neurology fellow here at UCSF and just finished neurology training. And I'm about to send you a detailed email because I'm in a somewhat unique situation where I was supposed to be in Zambia this year for a global neurology fellowship that was going to be the first of its kind, but with COVID that got delayed. And I'm just wondering about whether I might be eligible for that. So I will send an email with more information because it's a unique circumstance, but it's great to meet you all virtually, and I appreciate your help in sharing all this information.
All right.
See, good
Look forward to
example how
hearing
you
from you
all
again.
need to get out there and meet us because we're here to help you, okay? I was going to say one other point on the question about do you need to have international experience to be eligible? Will it be held against you if you don't? And Craig already answered that. No, you don't have to. Okay, you got to get started somehow, but you will. But one thing that we do look at is how do you make a case for your commitment to do global health in the future? That's a career path that you want to explore, maybe even have decided is a priority for you. Okay, but so we realize it's not everybody is for a whole bunch of reasons. Sometimes just because you come from a family that doesn't have any money, you know, I did that. You know, you can't to get international opportunities, experience. You got to start somewhere, and this could be it. But making that case of why it is that you are committed to exploring global health and developing a career in that field, if you know that far ahead, is important. Would you say, Craig?
Yes. Yes,
Don't
sorry.
check in with the PI on everything.
Anyway, I see the question about COVID-19 and what happens if the pandemic continues and disrupt our lives. I mean, we are trying to be as flexible as possible. This year we have for our fellows from LMICs, it's less, to be honest, it's been less of an issue, although you just heard Kusi mention that she can't go to Iquitos. But in general, the work is continued in general. For our US fellows, all have postponed or delayed starting the fellowship until either October or January, and then with a hope maybe being able to travel. Some have started their work remotely by remaining here in California. And then we had about 4 people, I believe, that decided to defer for an entire year. So don't have COVID stuff. Again, if you don't apply, your chance of getting the program is 0. If you do get it, if you do apply, you have a chance of getting in the program, and then we'll do whatever we can to make it work for you. And it, of course, it varies a lot, and it varies between our US fellows versus our LMIC fellows, and among US fellows, it matters if you're a student with a limited time frame versus a fellow that might be able to do something else for a year and then go back a year later. So we will do our best to work with you.
Craig, Mariah Coley, just put down her hand. Come on, Mariah, get it in here. You got a second.
Hi there. Thank you. I wanted to ask, so Pat and I met previously. I'm a doctoral candidate in geography at UC Davis, and I study agricultural systems primarily in Eastern Uganda, but I'm interested in East Africa generally. And one question I had, I'm looking at the successful applications on the website, and I was wondering if you might be able to share other applications if I email you directly that kind of have a bit more of a mixture of like ecosystems and environmental issues going on. Or I'm just looking because I haven't thought of myself as like a health researcher previously, but obviously some of the things that I think about and work on are highly related to health and nutrition. And yeah, I'm kind of starting to think creatively about what to propose. So just wondering if you'd be able to share
it's a
more.
great question, and maybe you and I could talk separately. I don't know if you're working with Kate Scow.
Yes.
Yeah, I am.
Yeah, so Kate, I mean, I know Kate well, and then we did have a fellow, Lauren Pincus, my suggestion, and Kimberly might be able to send you her email. I believe she's in Asia somewhere. You could write to her, maybe she could send you her up, because she's been the only, we want to have people from agricultural sciences apply for the program. To my knowledge, she's the only other person who has. So I think she would have the most relevant application, even though it was like 6 years ago or 5 years ago, somewhere in that range.
But we have had people related to fishing, aquatic, and related to nutrition and things like that. So Mariah, I'd really recommend you make an appointment with Dr. Cohen right away and discuss this, okay? But it's a good example of how we're looking for diversity, all right, in interest. So so if you don't have the right examples there, we want to help you with that. Okay, I'm gonna have to sign off, get on another call, but wonderful meeting all of you.
Yeah.
Take care. Good luck. Please.
Yeah, so Mariah, just reach out to me and we can connect, but we can also try to see if we can get, if you can connect with Kate about Lauren's application. So I want to thank Kimberly and Linda for arranging this, and I want to thank all of you for taking your time to join. Please send us additional questions you might have or interact with us. We're here to help you through the application process. And have a good, I hope the air is clear. I hope you all remain healthy through these tumultuous times that we're all living through. And this is definitely a global pandemic, and provides a real reason for why we are trying to advance global health and support the next generation of leaders in global health. So thank you, and have a good afternoon or evening, or for some of you, you should be in bed if you're in Uganda. So have a good night. Bye.
Thank you. Good night.